Let's start with Hong Kong.
There are concerns that there could be another major locally transmitted outbreak. That's according to health officials, and they attribute that alarm because of the number of new cases reported that are the result of unidentified sources. So on Wednesday, Hong Kong reported 19 new local cases. That is the highest daily increase of locally transmitted cases since April 1st. Of those cases, 6 are from unknown origins and the rest are from existing clusters, which include restaurants as well as an elderly home. And that compares to the entirety of June in Hong Kong, there only being about a dozen new coronavirus cases. So this is really a stark reminder that even areas that have been praised for an effective virus response, they cannot let their guard down. Hong Kong so far has only had 7 coronavirus deaths, so that's about 1 per 1 million people in Hong Kong. But now this new resurgence of cases could further damage Hong Kong's economy, which already shrank a record 8.9% in the first quarter.
Selina, in the meantime, Melbourne is back under stay-at-home orders. The economic toll will be huge given how reliant this economy is on services and tourism.
That's correct, Heidi. This is expected to prolong Australia's overall recession for the first time in 30 years, the first recession in 30 years. And even though this lockdown only applies to Melbourne, it is going to have ripple effects across the state, as well as the fact that this state is now going to be cut off from the rest of the country as other states close their borders. And Victoria contributes to about 1/4 of GDP, so it is quite significant. And Westpac's chief economist now expects Australia's GDP to shrink about 4.2%. That's compared to previous estimates of 4%. This increase is because of those new restrictions as well as border closures. Now, Australia had also enjoyed success in its early response to the virus outbreak as a result of closing its international border, as well as putting in place pretty aggressive contact tracing and testing regimes. But a mixture of complacency and mistakes in quarantining international travelers coming back has resulted in this new resurgence of cases.